I'm Malcolm Povey. I'm a patient at Slawit Health Centre, which is having its funding cut by 44%. I'm a diabetic, and those cuts will hurt me and all the patients in the area. Our local MP, Jason McCartney, has refused to accept our letter, which explains to him why these cuts are such a big mistake. This area has poorer health outcomes, and that is why healthcare is more expensive. Even so, it is only £162 per patient per year, which is an incredibly good value. And because of the service that the health centre gives to its patients, fewer patients end up in hospital than on average. We have to ask as well why 55% of all surgeries in Huddersfield will be cut in comparison to the national average of 44%. I've just run out of steam. So
Defend the NHS! Save Slawit Health Centre! Defend the NHS! Save Slawit Health Centre! Defend the NHS! Save Slawit Health Centre! Defend the
Health
NHS!
Centre that's under threat of being closed if the proposed cuts go ahead. But it is the same government that's underfunding all health services. And we were very shocked to hear yesterday that they're planning to close Huddersfield A&E. That is absolutely appalling. Huddersfield's a large town. So we're not only here for ourselves and our surgery, we're here to defend the NHS as a whole and all the other surgeries that are being threatened with cuts. We need A&E in both Huddersfield and Halifax, and we will continue to campaign for that.
We're going to get round to a small community, and you will look at, I won't say it, because his lady's about.
And it is a bit galling when he says it's nothing to do with him, and yet he's our parliamentary representative, and it's his government that is not funding the health service. And I don't see how he can say it's nothing to do with him. If he thinks that, what's he doing as an MP? Does he understand what the job's about?
Yes, and he's taking the petition. He's had numerous meetings with the CCG about it. He's made representations on the matter. But the decision's with NHS England.
And who funds NHS England?
The government.
Right, and
it's his government.
Is that a Conservative government of which
But it's NHS England that decides how to use the money the government gives it.
So but clearly if they were given more money, they could properly fund the health service.
But this is the new funding formula they've come up with.
You agree?
Sorry.
So is that why he's interested in the A&E at Huddersfield Royal Infirmary closing? Is that not the same issue, but he's interested in that, but not our surgery?
Because it's a 44% cut, potentially spells the end of the surgery. So this isn't just another cut. This is the start of the end.
If you're so interested to be out here, give us a pep talk. And it applies to me, doesn't it?
It's not that but it's appointment only, and he just can't see you today.
No, he hasn't offered us any appointment at any time, despite repeated requests.
He gets paid to represent his constituents. I would at least have the courtesy to give them 5 minutes. Certainly when there's such a major cut being threatened, which can affect everybody's life in the Colne Valley, that we'd like them to get. But, once these cuts go ahead, it doesn't bode well at all.
No.
And I think, if I was in his position, I'd be thinking about the votes.
The campaign, we've been making we've learned a lot about the health centre and the services, and we know that the personal medical contract that it has means that more people are being kept out of hospital, more people are being able to avoid all that bed blocking, which is a term the press uses.
Jason McCartney to
Right.
6th of February at 10 o'clock.
I'm not checking my phone. I'll note it down in an email to myself.
It's going to be from 10 o'clock to 12:30, and it's going to be a drop-in activity. So anybody is very welcome to come, and they could just come for 15 minutes. And so we'd like to invite our representative.
Because patients haven't been consulted in Slaithwaite, and so we're going to do our own consultation. with patients.
from the health centre that the average admittance into hospital from there is much lower.
Yeah.
And the whole, you know, so you're not looking at the thing as a whole. It's being looked at in terms of the high profile political things, right? And as a result, lives are being damaged.
I think Slawit Health Centre have actually saved money, haven't they?
They've saved money. They reckon they've saved about 100,000 in terms of hospital admissions. And I mean, to be honest, I was amazed to see it's only £162 per patient per year to fund that health centre, which I think is incredibly good value for money. And what Jason's argument is, well, but on average it's only 155, so Slawit Health Centre should be cut. But that just ignores the benefits that are flowing from the fact that that health centre is supporting a higher population of old people, more chronic in this area, health outcomes are worse than in the country as a whole. So it seems to me illogical to be cutting funding in the frontline service, which can actually improve outcomes in the way that they are doing. And particularly, the other question is, why is it Huddersfield that having such a big round of cuts? It's 55% of surgeries in Huddersfield are being cut, in comparison to, I think it's 44% nationally. Right. So areas like, you know, where health outcomes are really good are not being cut. But an area like this, where people need the support, are being cut more. Now, to me, this is a bias against people who are ill. And that isn't defending the health service, it's the opposite.
Yeah.
So you might think there's an element of, deliberate focusing on certain people.